Hello, I'm Dr. Ali. Welcome back. For those of you who are joining us for the first time, I'm a functional physician dedicated to providing education and guidance to our patients, their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health, and that by making simple, sustainable changes to your lifestyle, you can prevent and even reverse chronic disease. So, our topic for today is overcoming cancer using a functional approach. So, let's start off by talking about how does cancer start? So, cancer starts when a gene or several genes mutate or change, resulting in a cancerous cell. These cells start growing and multiplying, and they lead to formation of tumors. Then these cancerous cells break away from the original place and travel through the lymphatic system or the bloodstream to travel to other parts of our body. And that is when we talk about cancer spreading to other organs. For example, a tumor in your breast may spread to the lungs, making it hard for the lungs to perform its function. So the question is, does everyone have cancer cells in their body? And the answer is yes and no. So our bodies are constantly producing new cells. Some of these cells have the potential to become cancerous. At any given time, we may be producing cells that have damaged DNA. But that does not mean that they are destined to become cancer, but they have the potential to become cancerous. Our body has the ability to eliminate cells with damaged DNA, or our body also has the ability to repair the cells with damaged DNA. When a cell dies that has abnormal DNA, the process of dying is termed as apoptosis. When we lose the ability to repair these abnormal cells, or we lose the ability to cause death to these dysfunctional cells, then these dysfunctional cells start to grow and cause cancer. How are cancer cells different than normal cells? So there are certain properties of cancer cells which make them different from normal cells. So first and foremost, normal cells grow when and where needed. Unlike normal cells, cancer cells don't stop growing, and they continue to divide even when there is more than enough of those cells. And that is how they form a tumor. The second difference is that the cancer cells ignore signals. So cells send chemical signals to each other all the time. Normal cells obey the signals that tell them when they have reached their limit and will cause damage if they grow any further. But the cancer cells do not listen to the signals that are being given to them, which means that they are not under the control of the body's signaling system. The third and important difference is that normal cells stick to each other. On the other hand, cancer cells lose the molecules on their surface that keeps them in place, which results in them breaking away from their neighbors. Unfortunately, this leads to spreading of those cells throughout the body. A fourth difference is that normal cells can repair themselves if their genes become damaged. This process is known as DNA repair. Cells also have the ability to destruct and destroy themselves if the DNA damage is severe. This process is called apoptosis. Unfortunately, in cancer cells, they are unable to repair their DNA. And not only are they unable to repair their DNA, they also have a faulty process whereby they do not undergo apoptosis. And the result is that they continue to grow and they continue to get more and more damaged DNA, which leads to a lot of additional problems. The new genetic changes can cause these cells to grow faster. It may also cause these cells to spread to other parts of the body, and these changes can also make these cells resistant to chemotherapy. Last but not least, normal cells mature, and as they mature, they have the ability to carry out the function that they have been responsible for. This process of maturation is called differentiation. In cancer cells, the cells often do not mature. They reproduce so quickly that they do not have a chance to differentiate. The result is that they are often not functioning the way they are supposed to. So let's talk about how common is cancer. Cancer is one of the leading causes of death in the United States. And we now have the prediction that we will see 1,670 deaths a day in the year 2023 associated with cancer. And we are talking about 2 million deaths in this year alone. Now, what we have to understand is that cancer is something that any one of us can experience. And different genders and different races experience different rates or prevalence of cancer. So what we know is that men are affected slightly more than women. We also know that African American men are affected more than people in other racial groups. We also know that women who are American Indian or Alaskan natives have a higher risk of cancer than other racial groups. Almost any one of us can develop cancer. However, we do know that 88% of people diagnosed with cancer are 50 years or older. So how do we know that we have cancer? Unfortunately, we may not have any symptoms at the early stages of the disease, which is the reason why screening for cancer is very important. In the later stages of the disease, we see unexplained weight loss, we see fatigue, we will also witness pain, as well as organ-specific changes, which means that, for example, a lump may be noticed by a woman with breast cancer. Bleeding may be noticed by somebody with colon cancer, so on and so forth. What are the risk factors for cancer? So this is very important because when we talk about prevention of cancer, if we can eliminate the risk factors of cancer, then we can actually prevent cancer. And we know that most cancers are preventive in nature. We also know that when we have cancer, we can still eliminate the factors which have contributed to our cancer and improve our chances of survival and improve our ability to fight cancer. So let's talk about them. First and foremost, risk factor is infection. So we know that about 15 to 20% of cancers are linked to infections. Infections increase the risk of cancer in different ways. So for example, some viruses directly can affect the genes inside the cell that control their growth. These viruses can insert their own genes into the cell, with the result that the cell starts to grow uncontrollably, leading to cancer. So examples of some viruses which have been linked to cancer includes human papillomavirus. This is known to cause cervical cancer, vaginal cancer, anal cancer. Hepatitis B and C viruses are known to cause liver cancer. Epstein-Barr virus, EBV, is associated with several types of cancers, such as Hodgkin's lymphoma. We also have Kaposi sarcoma, which is a type of cancer linked with herpes virus. It's a special type of virus called Kaposi sarcoma associated herpes virus. It is important to note that everyone who is infected will not develop cancer. And the reason is because, in addition to the infection, other variables have to be there to be able to lead to cancer. These variables could be genetics, lifestyle, and environmental factors. The second important cause of toxins is environmental toxins. So in our modern world, we are constantly exposed to toxic chemicals in the air, the water we drink, and the food we consume. An important source of cancer is tobacco smoke. It is the leading cause of preventable deaths worldwide and is linked with cancer of lungs, throat, mouth, esophagus, pancreas, kidney, bladder, and cervix. Another very important cause of toxin-related cancer is alcohol. Long-term heavy drinking increases several different types of cancers, including liver, breast, colon, esophageal cancers. The third and important category is that of environmental toxins. Examples of environmental toxins include asbestos, which is found in building materials and insulation, linked to lung cancer, mesothelioma, and other cancers. We have benzene exposure as another example that is found in gasoline, in industrial solvents, and tobacco smoke. We also have radon as another example that can accumulate in homes and buildings, and exposure to high levels has been linked to lung cancer. We also know that UV radiation exposure from sun and tanning beds can increase the risk of skin cancer. Unfortunately, there are a lot of toxins that we consume on an everyday basis that also can lead to cancer. Pesticides have been linked to certain types of cancer, such as lymphoma, leukemia, and they are present in fruits and vegetables that we consume. Mold toxins is another example of environmental toxins which have been directly linked to cancer. So examples of everyday toxins that we consume includes chewing gums, lipsticks, chickens that actually contain arsenic that can lead to cancer. It is important that we understand what are the toxins that we are being exposed to, get assessed for the exposure of these toxins, and eliminate these toxins to reduce our risk for developing cancer. Stress. Although stress is not considered a direct cause of cancer, there is data that suggests that stress contributes to the development and progression of cancer in multiple ways. First and foremost, we know that stress weakens the immune system, which makes it difficult for the immune system to fight cancer cells. We also know that chronic stress can promote inflammation, which also contributes to growth and spread of cancer cells. Last but not least, stress has been linked to unhealthy behaviors such as smoking, excessive alcohol consumption, and poor diet. Last but not least, chronic stress can also lead to deprivation of sleep. And we know that insomnia or persistent difficulty falling asleep or staying asleep is a risk factor for certain types of cancer. And one of the reasons may be that lower levels of the hormone melatonin, which is produced during sleep, could be the cause of this risk. Melatonin has anti-cancer effects. It helps the body's ability to regulate its internal clock, and it also helps to suppress the growth of cancer cells. One of the most important variables to consider when we discuss the cause of cancer is the immune system. We know that genetic mutations play a significant role in causing cancer. As we age, the frequency of mutations or genetic changes increases, and if our immune system's ability to repair those changes is impaired, then we are going to be at high risk of developing cancer. Inflammation. Inflammation can be caused by infections or toxins. Over time, chronic inflammation can cause damage to the DNA and lead to cancer. We know that people with chronic inflammatory bowel diseases, such as ulcerative colitis and Crohn's disease, have an increased risk of colon cancer. Obesity has been linked to increased risk of several types of cancers. Part of the reason could be that obesity is actually a sign of chronic inflammation, which could be the reason why there has been a link between obesity and cancer. Additionally, we know that fat tissues produce hormones and growth factors that can stimulate the growth of cancer cells. Several types of cancers are hormone related, meaning that their influence can lead to cancer. For example, in breast cancer, we see estrogen and progesterone may play a key role. Similarly, in prostate cancer, we find that androgens, particularly testosterone, can play a role in its growth. Ovarian cancer and endometrial cancers are other cancers where estrogen and progesterone may play an important role. Now, it is important to remember that not all cancers are hormone related. And even those that are related to hormones are not simply because of the presence of hormones, because we all have hormones. There are many other factors that come together in addition to hormonal imbalance that leads to these cancers. What is the functional approach to treat cancer? There are three pillars of treating cancer through a functional approach. The first and foremost is to understand and identify the root cause of cancer. Every individual is different, which means that the root cause of cancer is going to be different in different individuals depending on their exposure, depending on their immune system, depending on the inflammation, their weight, the toxins they have been exposed to, their nutritional deficiencies, so on and so forth. The second important pillar of addressing cancer through a functional approach is the strengthening of the immune system. To allow the immune system to get rid of cells that are dysfunctional in nature. And last but not least, if a patient opts to go with chemotherapy and radiation, then it is important to reduce the damage caused by these powerful modalities used for treating cancer. One of the most important aspects of functional medicine is its ability to look at the bigger picture. It is not just about getting rid of cancer at one point in time, but it is about preventing recurrence of cancer and avoiding the potential side effects from the therapies that are used to treat cancer. So, the functional approach looks at the bigger picture and looks at the person as a whole to address the problem. We provide a comprehensive integrative approach to address cancer by working with patients and their care team to achieve the goal of strengthening the immune system, removing the root cause, and preventing recurrence of cancer.